There's two major operational challenges that I think we as a CRO or our sponsors face when they're managing these trials. The first one is really that we have to stay on top of the data differently. In a traditionally designed trial, while we want source verification, data entry, all of those things to be done throughout the trial, the fact is, if it all waits until the very end, that's completely acceptable because you're really just waiting for one final analysis. In an adaptively designed trial, it's absolutely critical to have that data entered very timely, to have it monitored and queried, et cetera, right on time, because whether you're just going to a scientific review committee comprised of the investigators and the sponsors, or you're going more formally to like a DSMB or a DMC, it's critical that they have good data to assess. We can't be doing this off of anecdotal interviews. Defining that data collection strategy, knowing exactly what data is important to the analysis, when it's going to be assessed, and how timely that turnaround has to be is absolutely critical for everybody involved. It's important for the stakeholders, it's important for the monitors, for the data review and biostatisticians teams. We really want to minimize the gap that's created by the analysis of the data so we don't incur long pauses in the enrollment of the study. So that's number one. Number two is that after we make a decision, it can drastically change the design of the trial. So you may be able to keep going as you have been doing. If you're using a Boyne design, it may just mean enrolling another cohort with the same sites. If it's a Simon 2 stage, it may mean that you have now a massive expansion in the number of expected patients and you're completely underpowered in your number of sites and your geographic footprint. So there's a risk analysis that has to be done to decide, are we going to spend money to proactively start to activate sites in anticipation of that increase? Are we going to wait until we have the data in and accept the delay that causes? It's really going to be a different decision for every single sponsor based on their financial position and their needs to complete the trial quickly. But it is something to be considered and discussed because it could change whether or not you choose to run that adaptive design in the first place.